Hello, everyone. Our speaker today is Kristina Barker. She is the manager of the pharmacy at the Sam's Club in Plano, Texas. She is not on Zoom, but she is using her phone today because she is at work today. She needs to be able to move around. Kristina is a graduate of the University of Texas College of Pharmacy. She has over 27 years of experience as a pharmacist, working most of the time in a retail setting. She is also passionate about caring for all of her patients, but especially those patients who are older adults. She cared for both of her parents as they aged and has extensive experience with navigating the healthcare system as a Medicare patient. So we have an eminently qualified speaker, not just about older adults and medications, but also having walked the walk of a caregiver. Kristina, again, thank you so much, not only for setting aside time for us, but the flexibility you've had as we navigate using all of these technologies.
Well, thank you so much for that introduction, Xanda. I am happy to be here speaking to you all today. And the topic that I chose to speak about is medication safety for older adults. And so as we all get older, we're also more likely to use many more medications. And anytime we add medications, then we have a chance of harmful side effects and then also drug interactions. Another thing, as we age, some physical changes with our bodies, like less muscle mass, more body fat, our liver and kidneys don't function as well as they used to. All of those things can also affect the way that medications are handled by our bodies, and this can lead to potential complications. And so all of the changes that do occur with aging can make people more likely to suffer medication-related problems, or MRPs. And in fact, about a fourth of all nursing home admissions are due at least in part to the inability to take medication correctly. And the CDC does estimate that over 125,000 deaths occur each year because medications aren't being taken correctly. So those are some pretty scary statistics. And so what I want to do today is just to provide you guys some important safety tips when it comes to medication. And so the first one of those is to take medication as prescribed and to also get input from your healthcare provider. So take those medications regularly and take them as they are instructed. If you're having side effects or you have any questions about your medications, talk to your medical provider and also talk to your pharmacist. Pharmacists, we are a wealth of knowledge when it comes to medications, and we are also very accessible. So have that good relationship with your pharmacist, and it will go a long way with a lot of things, but especially with keeping all of your medications straight. Second thing is, don't take any medication that hasn't been prescribed for you. I have patients that will be out of a refill of one of their medications, and like the wife will say, well, I'll just take my husband's. We don't encourage that behavior because it could be the same medication, but it might be a different release mechanism, or it might be a different dose than what you're taking. So only take medication that has been prescribed for you. Next is, don't skip any doses or stop taking medication without first talking to your provider. And if you can't get in touch with your provider, call your pharmacist. Having trouble remembering medications is also an issue that we see a lot. And so if you do have a patient that's having trouble remembering how to take their medication or when to take their medication, talk to the pharmacist. We have tools like pill boxes. We have automated reminders that we can send to you to remind you about refilling your medication. You can set alerts on your phones and things like that to remind you when to take your medicine. But I can't stress enough, it's so important that all patients take the right medicine at the right dose, and then they also take it at the right time of day. Next tip is to store medications properly, and then also to check expiration dates. So we all know about storing medications. Most of our bathrooms or some bathrooms are equipped with a medication cabinet. That's actually one of the worst places to store your medications because there can be wide fluctuations in temperature and in humidity. So don't encourage any patients to store their medications in the bathroom medicine cabinet. Another thing is to keep all medications up and away from children. If your medication is expired, don't use it. Expired medications can be less effective or risky due to changes in the chemical composition, or they could be less potent because they've lost some of their strength. There's certain medications that are at risk for having bacterial growth. And then also if you're taking an antibiotic that's expired, then it might not work well enough for the infection that you're trying to treat. And it can also lead to a huge problem that we have, which is antibiotic resistance. When you also think about medications, say, that are expired or medications that have been discontinued by your physician, then a huge problem comes up. What do we do with all these medications? And I can tell you that a lot of people used to just wash them down the sink or put them in the toilet and flush them. And that all goes into our water supply. And that makes things unsafe for the water supply. So there's some simple steps that you can do at home to dispose of expired and unused medications. First thing is make sure to read the labels. A lot of times the labels will give you some instructions on how to dispose of the medications. Another thing is participate in the drug take-back programs. The DEA sponsors the National Drug Take-Back Days, usually 4 times a year. And so I encourage you to participate in those days. They usually partner with local law enforcement. They will have drop-off locations in all the communities, and patients can just literally drive through and drop off those old medications. There's also a lot of retail pharmacy chains that have drop boxes where you can just bring in all of your older medication and drop it there, and then it will be disposed of safely. They contract with companies that will come and do pickups and dispose of those medications safely. You can also follow the federal guidelines where you can actually dispose of medication safely in your household trash. So the first step in that is to mix the medications with an unpalatable substance. So things like dirt, kitty litter, used coffee grounds. Mix the medications with those substances, and then place that mixture into a container. So we usually recommend doing it just in a sealed plastic bag, like a Ziploc bag. And then you actually can throw that container in the household trash. And then you're also going to be left with a lot of empty prescription bottles. And so we encourage you to scratch out all of your personal information that's on those pill bottles before you throw them into the regular trash or into the recycle bin. Next safety tip that I have is to be aware of potential drug interactions and then also potential side effects. So later in the talk, I'll talk about different things that you need to make sure to ask your provider, also ask the pharmacist about the medications, and we'll kind of go over that more in depth. Next tip is to keep a medication list. So what does that mean? Keep a current list of all the medications that you're currently taking with you. So on that medication list, make sure to include both brand and generic names of the drugs. Also include any over-the-counter medications, any herbal medications, any supplements that you might be taking. Include the indication or include why you're taking the medication. Include the dosage of the medication, how often you take it, and then the phone number for the pharmacy in case someone needs to get in touch with them and find out about anything about your medication. Also consider giving a copy to a friend or a loved one that you trust. If something were to happen and you were to be incapacitated, one of the biggest questions that they would have with the EMS or with the emergency room is, what medications are you currently taking? So if you don't have that list on you, they could reach out to your friend or your loved one and get that list of medications. Another thing that's provided, and all the Medicare Part D plans do offer this to Medicare patients once a year, where they can go through a medication review. And they can do that with the licensed pharmacist, and that pharmacist can actually make recommendations of ways to make their medication regimen easier to take, maybe ways to save money on their prescriptions and things like that. So that's a free service that all the Medicare Part D plans do provide, and it's something that to encourage patients to participate in. And then lastly, each time that you visit your doctor, tell them about any new medicines that you're taking, and then also ask them, do I still need to be taking all these other medications? The next tip is to keep medications organized. So store the medicines in the bottles that they came in. Don't remove those prescription labels. Don't dump all of your pills together in one bottle, or dump them all into a bag or into a box. That's just an accident waiting to happen. Don't remove pills from blister packs until you're ready to take them. Pills are packed in blister packs for a reason, and it usually has to do with the stability of the drug. So if you take it out of that blister pack, it might not be getting the protection that it needs in order to be stable. And then any liquid medications, make sure to keep those in the original bottle as well. Don't pour them into any jars or other containers. And then when it comes to liquid medications, make sure to measure those correctly. You want to make sure to use an oral syringe or a marked dosing spoon or dosing cup. Don't use kitchen teaspoons or tablespoons to measure medications. The next to the last tip is to tell your doctor about any alcohol, tobacco, and drug use. The reason is that those things can interfere with medications and how well they work or don't work. And then the last tip is to turn on the lights. Don't ever try to take your medicine in the dark. You might miss something on the label. You might be mixing up your medication. So just always encourage patients to make sure not to take their medications in the dark. So I'm going to pause here and just open up if there are any questions about what I've covered so far. I know it was a lot of information, but those are really good tips. And it's actually the information that I had Xanda to send out. It's got all of those things listed there for you.
No, it was really great information, and the attachment to the email also helps.
Okay.
Do you mind repeating that Medicare information? I had to step away for a minute.
Oh, okay. So any Medicare Part D plan will pay for a medication review with a pharmacist once a year.
Thank you. I tried to listen to it from where I had to go, and I missed most of it.
Oh,
Thank
no,
you.
no problem.
I did not know that.
Yes, ma'am. Okay, so I'm going to move forward and talk about what questions that you need to ask your doctor or your pharmacist about your medications. So one responsibility of patients and their caregivers is to fully prepare for your medical appointments. So that means before you go in to see the provider, make sure to write down everything that you want to talk about. A lot of us get really nervous when we go into a doctor. We have that white coat syndrome. Our blood pressure will sometimes be elevated, but we forget about all that we plan to talk to that provider about. So write down everything and write down any questions that you might have related to any medications. Another thing is to take notes during your appointments. They give you a lot of information during those appointments, and sometimes you might forget things. So take notes during the appointment, and then look over them after the appointment. And then lastly, if you do have any questions about anything that was covered in your appointment, make sure to call that doctor's office back and ask those questions. You can also ask your pharmacist about any questions that you might have about medications. But everybody should leave their doctor's office and their pharmacy if they do have a new prescription, and they should know certain things about that medication. So knowing why it's prescribed, knowing how it works in the body, knowing what they expect to feel once they start taking the medication. How do you know if it's working for you or not? Is there a typical time period when you might have improvement of your symptoms? How long will you have to take the medications? There's a lot of medications that aren't intended to be taken for a long period of time. Sometimes doctors will give extra supplies, but other times they do not. And the reason that they will not give extra refills is because they want you to check back in with them, make sure how you're doing with the medication before you continue to take it or not. Should you take the medication with food? And then also another question is, are there any foods or beverages that you might need to avoid while taking the medication? Also asking, is it safe to drink alcohol while you're on the medication? Ask any activities that you should avoid while taking the medicine. Another question that's really important is, can the medicine be chewed or crushed or dissolved in any liquids or mixed with other medications? I actually have a patient here at our pharmacy that has dementia and is chewing all of his medications. And we were not aware of that. His wife, his caregiver, forgot to bring that up. And the patient was getting a medicine to prevent seizures. And this medication was a control release medicine. But what was happening is he was chewing the medicine. And so he was getting the entire dose of the medicine all at once instead of it being spread out over a 24-hour period as intended. And so what happened is the patient kept having seizures. And they finally concluded that the reason was because he was chewing his medication. And so anytime anything changes with the patient, it's so important to tell the doctor, tell the pharmacist, because there are adjustments that can be made to the medication regimen so that you don't have any issues like this patient. What possible problems might you experience with the medicine? And how can you prevent the problems from occurring? And then also, if you are having problems, at what point do you report that those problems to your doctor or to your pharmacist? What do you do if you miss a dose of the medicine, or what if you take too much of a medication? Those are super important questions to ask. And a lot of times patients won't ask until that happens. And so that's why it's so important to have a good relationship with your pharmacist so that you can call and ask those questions in the event that you do forget that you took your morning dose and then you take an additional morning dose. Or if you forget your morning dose, and then do you need to double up later in the day? What's the cost of the medicine that's prescribed? There are a lot of very expensive medications out there, and a lot of patients are on fixed incomes. And so it's really important to know what the cost of the medication is going to be. And so that way a patient will know whether or not they'll be able to afford that medication every month. Is there a generic available? And if so, is it okay to use the generic instead of the brand name? Ask for written information. At pharmacies, we have to provide you with written information about the medications, but that's given to you so that you can read over it and make sure that you don't have any other questions. Okay, so now I'm going to talk about medications and traveling. So we've been through the pandemic. We're about two and a half years into the pandemic now. And a lot of people have not traveled for quite some time. And a lot of those people are actually starting to travel again. And so just a couple of reminders about traveling and medications. So make sure you carry that list of medications with you. Also with that list of medications, make sure you include your doctor's name and phone number and your pharmacy's name and phone number. Also ask your doctor or pharmacist if you need to adjust your medication schedule because you're traveling to a different time zone, your routine's going to be different, your diet's going to be different. Another thing to point out is make sure when you're flying, don't put your medication with your checked baggage. Take that within your carry-on. And I also encourage patients take enough medication in case your flight gets delayed and you have to stay longer. And then also make sure to keep any medications out of heat and out of sunlight. Okay, and so the last part of my presentation that I'm going to go over is something that's called the beers list. And so many of you may have heard about the beers list. Many of you may not have heard about it. It has nothing to do with actual beer or alcohol. It's actually a list that was developed by a Dr. Mark Beers in 1991. He and some of his colleagues published a paper that described the development of a consensus list of medicines considered to be inappropriate for long-term care facility residents. And so that list has now been revised more than, well, it's in its sixth edition right now. And it's used by so many different clinicians, both in the outpatient and the inpatient settings. It's not used just for long-term care facility residents. What they will do is use this list for all patients that are age 65 and older. And Medicare plans will also utilize this list of medications, and sometimes they will, because of medication is on this list, they will refuse to pay for that medication through the Medicare plan. And so patients might have to seek out other ways to have coverage for that prescription. So this list is not an end-all be-all. It's something that should be used kind of as a guidance for patients, for their providers, for pharmacists, to look at ways that they can intervene with that patient's medication regimen and suggest changes that might be safer for the patient. So a lot of the drugs that are on this list are related to an increased risk of a patient falling. Also, some of the drugs that are on the list are included because, like I said earlier in the presentation, our kidney function and our liver function is not as great as it used to be when we were younger. And so sometimes modifications to drug therapies have to take place. And certain drugs are more impactful than others when it comes to that. So as part of the handouts that were given, we give you the all-encompassing list and also an explanation of why these certain drugs are on the list. And so I encourage you, if you are taking one of these medications, or you are caring for someone that's taking one of these medications, it's a situation where you just need to ask more questions. And so it's not something that, oh, I have this drug, it's on this list, I've got to stop it right away because it should be avoided. Definitely, that's not what this list is about. It's just about making you aware that there are certain risks with these medications. And so you need to ask more questions of your doctor, ask more questions of your pharmacist, and get some more information as to whether or not that drug is appropriate or not. So I'm not going to read all the different drugs, but just know that if someone is taking one of these medications, they're not to stop these medications abruptly. They've got to talk to their doctor. They've got to talk to their pharmacist, and they have to. There's a lot of those drugs that they can't just stop abruptly anyway. They would need to be tapered. But it's something that has to be individualized for each and every patient. And so that's where all those extra questions come in. And so that's all the information that I have prepared for today. But I will open the floor up now if there are any questions about what I've discussed, or any other questions that I might be able to answer for you with regards to any prescription, over-the-counter medications, anything like pharmacy services, pharmacy discounts, things like that.
Great. I have several from chat. Do you have questions you would like to ask first, or should I read the chat messages? Because there are some questions that some of you may have this same question. Does anybody have a particular question you want to ask the pharmacist?
I think the chat questions are going to be good for the moment.
Okay, let's start with that. We can always shift to and by the way, if you want to chat, submit a chat message, fine. Or after we're through with these, we'll open it up, and you're welcome to answer those questions.
I have a question.
Yes, ma'am.
When we get a prescription and on the prescription it says take one daily, is that the responsibility of the pharmacist to tell us, or the doctor? Do we take it morning, noon, or night? Sometimes there is no clarification. It just says take one daily.
That's something that your doctor and also the pharmacist can clarify. A lot of times it depends on the medication. Certain medications will be better if taken in the evening just because of a drowsiness side effect. But typically, if it says one daily, that's usually for the majority of prescriptions is once a day in the morning.
Good clarification. Let's go to the chat messages, and then we'll still have time for you to ask your questions. Hidalith Rincon is asking, does Medicaid cover medication review?
Yes, it does.
Okay, that was an easy. And so it doesn't matter what state, because by the way, folks, we have states from across the country today. Does it matter state, or since
I can really only clarify for Texas, but I would say that most likely they would, just because the benefits of doing a medication review outweigh any cost prohibitive things.
Very helpful. This is Lori Verona. Very helpful tips. We made 2 notebooks for mom and dad that includes doctors, medications, and illnesses for emergencies and caretakers during the day. We also created a special chart that included my mother's sugar chart with time and name of medication needed to give it to her. We also have a chart laminated that includes how many units of medicine need to be given due to sugar levels at that time. And then she followed up, is it true that the more medication one takes, more medication one uses, it takes away the B complex in our body? I assume that's vitamin B.
No, no, that's not something that just by taking more medication, it's not going to deplete our vitamin B levels.
Okay. Other questions from any of you? Go ahead.
One comment and then a question. I thank you for talking about reminding us to take a few extra days worth of medications. We go to Texas often because we have family down there. And this one time I had exactly 6 days for him and for me. And I fell and ended up in an emergency room and got delayed coming home. And my husband does have dementia, and he needed his medication. And we jumped through some hoops, but we did end up getting a new prescription. They prescribed, one for me. Getting off the airplane and getting onto another airplane was easier than finding a pharmacy to give me a small prescription. So I learned the hard way, as we often do, and I will never leave again without another 3 or 4 extra days of medication. But I really, really appreciate the reminder about probably like a notebook. I mean, I carry file cards with his and mine on it, with a detailed list, because I take a lot of supplements. His medication is relatively short and sweet, but I take supplements on top of the few things I have to take. But I like the idea of being far more detailed, because we are older now. We're in our 80s, and I like that. I truly appreciate. In fact, I'm not even sure I'm not going to do the lamination thing, but because that way it's more obvious. People will say, well, what's this? If they need to go into my pocketbook or something to get stuff. Thank you so much for this.
Mm-hmm.
A quick comment about the taking binders and that type of thing. A lot of this came out of some of the weather disasters. And the idea is keep everything portable. And so take your notebook with you when you go to the doctor, and with lined paper, and have it organized in such a way as it's doctors and medications and history of what was said at the last appointment you had, any receipts that you have, anything for insurance. It's like it's all one place. I think that our tendency is to have a file cabinet, but life doesn't happen according to file cabinets. But just think in terms of portable. That made a lot of sense to me, and I tried to do that with my mom. I have a question, and then some of you may. And again, those 2 resources she talked about will come through your email. Since the participants, they're primarily caregivers. Kristina, do you find often that you kind of sometimes feel in the middle of the patient and the physician, or the caregiver and the physician, meaning that a physician, a doctor will prescribe a certain medication, but when it comes to the pharmacy, it's either extremely expensive, or the pharmacist that you have those lists, and well, this isn't a good idea to be taken with this. And it's not necessarily one doctor. Maybe it's because they have several doctors. How often does that happen? And do you have any pointers about that?
So that happens multiple times a day, every day.
Mm-hmm.
We spend most of our time on the phone with either there's a couple of things. We have to spend a lot of time on the phone with a physician's office because of maybe drug interactions, maybe the medication is not preferred on their insurance, and so they have a higher copay. So a lot of our day is spent trying to resolve the problems for our patients. And so there's a lot of things that we do kind of behind the scenes that patients don't ever even see or know about. So yeah, just having a good relationship with your pharmacist is invaluable, just because we can solve a lot of those problems. And if we have a list of all your medications, and if you just come to us and you don't go to multiple pharmacies, it makes things so much better, because we are able to catch any duplications of therapy, any drug interactions, anything like that, and we can intervene on the patient's behalf and speak to the doctor and get things resolved before the patient ever comes to pick up their prescription.
I really appreciate that comment. I remember being told once, and I think it's very true, that in healthcare, the two most important relationships to build are with your pharmacist and with the front office staff at the doctor's office. I have another question. Going back to Ann's comment about the difficulty of getting a prescription filled by a pharmacy in a different state, would you recommend going to the hospital instead of trying to get a pharmacy to fill it?
So if you're going to the hospital, you're still going to, that would be like going to the emergency room. They will still end up giving you a prescription that would have to be filled at a local pharmacy. So it's probably, I would advise, if you run out of medications, but like her situation where she was there and had to stay longer due to an accident, then you just you can reach out to your local pharmacy and ask them to transfer the prescription to a pharmacy in the area where you are located. Also, if you use any chain pharmacies, they all have a network that, like with Sam's Club, we are in the same network as Walmart. So if a patient gets anything filled at a Walmart or Sam's, we're able to actually go in and see those prescriptions, and we can transfer them, or we can call the physician and get a new prescription for the patient. I would not encourage you to go to the hospital, because that's just going to be more cost, more waiting, and then you would still have to get a prescription filled.
Other questions from the group? Sir, hold on just a second. Go right ahead. Mr. Franklin, you're still not unmuted. Hold on. Okay, well, hold on.
Can you hear me now?
That's it. Got it. Thank you.
Okay. This question for Kristina. She mentioned that some of the drugs that you take are just not for long-term usage. And my question was: is blood pressure medicine one of those medicines that are not for long-term usage?
So that's something that if you take a blood pressure medicine and then you make changes with your lifestyle and with your diet, sometimes those blood pressure medications can be discontinued.
Well, that was one of my questions.
Okay.
Thank you.
Thank you.
Helpful. How about the rest of you? Do you have questions? Who's smiling? He got that question answered. While you're giving some thought to it, I wanted to offer a couple of things. I manage a website that is funded by 2 area agencies on aging here in North Central Texas. And one of the things that one section is a blog. And on that blog, and I'm going to send this link to Teleconnection, and if they can send this to you, we have a blog that includes a typable as well as a PDF of a medication log, when to take it, what it is, what it's for, and also have a list, typable or PDF to fill in by hand, of a medication list. So we'll make sure you get that. And Kristina, I found your lists in general were also helpful. And do I have your permission to use some of that and put that in a blog also?
Absolutely.
I think the comment about using chain pharmacies, there is something to that. And many people like to support their local or grassroots pharmacy, but perhaps traveling especially, that might be a really good idea. So looking
I
at,
have a comment or something, information that I found beneficial was that on your telephones, inside your settings, you have a medical section to where you can put in like your prescription information and health information. You know, so when you're traveling or away from home or you know, having to fill out information on your medical needs, you have it readily available on your telephone.
and Mr. Norman, I think that's an excellent idea. The trick is keeping it updated.
True.
That's always the trick, but in my case, my husband doesn't, he's a point in, you know, that kind. And so the last time we had to go to the emergency room, we didn't have the updated list. So there's always value to having a printed copy as well as having it in your phone. Another idea that I've kind of gotten and some of you may be doing this in a habit, I take pictures with my phone of almost everything. Med lists, almost everything, including my our COVID vaccination record. Just pretty much anything that we might need in a doctor's office. Extra copy of the Medicare, the insurance documents. Those phones are so valuable. But Mr. Norman, it's at least if we did that, it would be a start. It would definitely be a start. And do all of you have in your phones an emergency contact that says emergency?
Yes.
For your loved one, especially for yourself, but also for your loved one. There for a while, they were wanting people to do ICE in case of emergency, but I found that not everybody knows what that is. So I just thought everybody knows what emergency number means. Other questions that you have?
Yes, I have one.
Please.
Because being an older adult and taking care of an older adult, I understand UTIs can cause confusion and things such as that. How can you, with all the medications that you have to take, what can you possibly do to help eliminate, you know, getting UTIs? Or does cranberry juice really help and all of that, you know, to keep things diluted in your system so that you don't get the UTIs? Because my husband has early onset dementia. So, you know, how can I tell the difference, you know, if he's just having a bad dementia day or if he's once again with a UTI?
So cranberry does help, and the way that it helps is it helps to acidify the urine, and by having a more acidic urine, the thought is that bacteria doesn't grow as well in that environment. Cranberry juice has a lot of sugar, so you have to think about does the patient have diabetes or not? And there are some low sugar alternatives to fruit juices, but then they also do make a cranberry extract tablet. The only thing is that's another pill that someone has to take, and if they already are taking a lot of pills every day, then that's just you know, an additional burden. But cranberry does definitely work. The other thing is to ensure adequate fluid intake. The whole 8 glasses of water a day really does work. because it keeps our urine more dilute. And there are actually over-the-counter tests that you can buy to test for a urinary tract infection. They're sold in the same area of the pharmacy that sells like pregnancy tests. But it's like a first response urinary UTI test, and you can actually test to see if there's bacteria or not. You still have to follow up with the doctor, but that might give you some peace of mind.
Okay. This is Angie Powell. Made the comment that patient portals from many physicians keep the medications up to date. A question about that: if the patient is seeing more than one doc and they're not all part of the same practice, they have a specialist over here and a specialist over there, is it been yours or any of your experience that the primary care physician will keep all of the medications on a patient portal? Or is it just going to be the medications that that physician prescribes? Hold on, let's get you unmuted if we can. Do you know where the unmute button is on your system?
Here we go.
That's
me?
better.
Okay.
That's
In my
better.
experience with my primary care physician here, I tell her when something comes up, and I also provided her with the over-the-counter things that I take regularly. That's also listed in my patient portal.
Okay,
And
so she tracks other physicians also in your good to know.
absolutely, and it would be helpful if they did, keep up with other appointments with other doctors and things like that in the portal. That
Yeah,
they
well, I'm not concerned so much about the appointments as the medications, making sure other medications are taken care
the portal is great for a lot of things.
of. Mhm.
It's not an end all, but
Yeah.
it
But
is
it's another tool.
exactly, and it's very helpful if you're out of town or something. You have to be able to get that prescription information to a pharmacist that you're not in the chain with. They're able to see everything there, and they also have the best information for contacting your doctor to get a prescription created for you, or at least that was my experience.
Good. Personal experience. And I'm a big believer in redundancy. Have it on the portal, have it on your phone, have a printed copy. We just don't ever know what situations we might find ourselves, that we might need that information, that we don't have a phone I can use, or I don't have a laptop that when I get to the emergency room. But that's a really good idea, or at least the ERs know where to look. Yes, ma'am. Go ahead.
Yeah, I like the idea of having it in multiple places because the portals are password protected.
Mhm.
And even your phone can be, password if you're the one that's, knocked unconscious or
Right.
whatever, or in my case too, just like Carolyn's case, my husband would not be able to begin to do any of those things if it was just him and I. So I think the redundancy is huge.
Mhm. And that goes for your, this is not the same topic, but that also goes for your care. That also goes for your, Kristina just put, did everybody see that? Good. Put copies of your, carry copies of medical power of attorney with you. Because if you just keep them at home in a lockbox or at the bank in a lock spot or file cabinet, life doesn't happen that way. Keep them with you at all times if you have a DNR or medical power of attorney. Kristina, we know you're busy. In the next 3 minutes, do you want to either summarize or make some last minute comments?
So I would just like to thank everyone for your time and your questions. I learned things today that I didn't know, and I always try to do that every day. So I really just appreciate you guys, and thank you for having me, Xanda, and I look forward to maybe doing this again for you sometime.
I hope, well, actually, I was thinking next year, but but thank you again. And I appreciate your patience and your flexibility for being the first of our teleconnection that I'm using, hosting a Zoom teleconnection. And if you need to jump off, we completely understand, but there were a couple of more chat, and it wasn't a question so much as comments, and I wanted to provide some resources.
Okay.
Someone made the comment, the power of attorney is also in the notebook. Absolutely. Everything that has to do with that with your loved one's care is in that notebook. And if you think about security or whatever, okay, put it in your trunk. But how many caregivers have been at work and they got a call? I'm one of them. They got a call to meet. In my case, it was my husband. And I didn't have a notebook because at the time he wasn't that sick, but redundancy and having it close at hand. I wanted to talk just a minute about resources. Hopefully everyone is already aware of this, but across the United States, and I don't know if it's in Ontario, I know we have one person from Canada. If you dial 211, it is a Health and Human Services number across the United States. And you would just see, I need help identifying help with my loved one. I'm a family caregiver. And they would have probably several connections they will make in your community. They will probably, send you to another number, but they can do that automatically. Also, you are very aware, of course, of Caregiver Teleconnection, what all they offer, their classes and the radio and these, and they have a conference. The Alzheimer's Association has the easiest website of anybody, alz.org. It is a tremendous source of information, communication, behavior, stages of Alzheimer's, what's the difference between Alzheimer's and other dementias. It's just a wealth of information in a pretty user-friendly way. And it also will link to education and to support groups. Area agencies on aging are across the United States. They're funded by the federal government primarily. And you can reach that. I just suggest the easiest way is put into your web browser, Area Agency on Aging, and then your county or even your community. And it will pop up the closest area agency on aging. And you can click to that and find out what services they offer in your community. There are some services they have to provide, but they're just different. Services are different. One of the things is short-term respite care, which is one of the things the Alzheimer's Association does also. The last resource I want to refer you to is through the Dallas and the North Central Texas Area Agency on Aging. I manage a website, and it is Family Caregivers, plural, familycaregiversonline.net, familycaregiversonline.net. Or you can put in my phone number or my name, which is Zanda. I think you can see it on the screen. Zan. Thank you, Minerva. Zanda, and last name Hilger, Hilger. And that will pull up that website. And what we've tried to do is put, and you will never be solicited. This is publicly funded by all of our tax dollars, but this website has frequently asked questions, a calendar of events that includes many of the Alzheimer's programs, but primarily that calendar is for North Central Texas. However, with COVID, many of our events are virtual anyway, so it doesn't matter where you are, just like with teleconnection. There is also support groups, and we link to the Alzheimer's Association. They have a support group link that's part of something called Community Resource Finder. But again, your area agency on aging can help you find those resources. I didn't mention the Aging and Disability Resource Center, ADRC, and that is also something that you could research. ADRC. You don't have to be aging or disabled, but it is a good resource. on our website, we have blogs, and if I love how the support I've gotten from Minerva over the years. She's awesome. And I'm going to ask her, once I pull together a blog about what Kristina has shared with us, I also want to send her a link to a blog that we have about medication safety, and that has those medication logs and the medication lists that are for your use. And the beauty of having it on your, I encourage you, everybody, to put a medication list, save it on your laptop, and that way it's easy to update and make a copy, take a picture, make a copy. Okay, with those comments I made, is anyone have some other questions you would like to ask of each other, or of me, or of Minerva, who is signed in from teleconnection? Okay. Thank you for your time. I hope this was very beneficial for us. I think Kristina did a really good job of breaking down what sometimes can be very complex. Look at that beers list. We encourage you to make a copy of that, because as we all know, many of the people we take care of have seen the same doctor for years, and they're reluctant to change doctors. And that's why having that relationship with the pharmacist is so valuable, because we as the caregivers can intervene. And those of us that have cared for somebody with dementia or Alzheimer's, sometimes we have to have side conversations with those physicians to make sure all the right information is getting out there. All right, thank you very much. And thank you for all the information. This was great from Ms. Rincon. We appreciate that. Hopefully you've got a lot of walk away pieces of information. Refer to the handout. Kristina did an excellent job. She just outlined everything she talked about. Thank you. And some of you I hope to see next month. Bye. Thank you very much, Minerva.